Genetic conditions are rare, life-threatening, and tragic conditions that no parent could wish upon their child. The discovery of genetic conditions usually is discovered after the development of symptoms in the child. Most genetic conditions have possible treatment if discovered before symptoms progress or begin. Newborn screenings that children receive at birth do not screen for all devastating and deadly conditions. Krabbe disease is one of these conditions that is not screened for at birth. Newborn screening needs to be modified to include testing for Krabbe disease due to the simplicity of testing, the relatively low cost it would take, and the test's ability to save the many lives of children. Some lawmakers have not decided to include these tests in the newborn screen due to the fact of the inaccuracy of testing and the fact that there's very low research on how effective these treatments really are. A newborn screen is a test conducted at birth that consists of a few drops of blood and screens a child for numerous diseases. Screening tests have become the basis of preventative medicine, and early intervention has been proven key to treating and sometimes curing diseases that were deadly in the past. Only some states test for Krabbe disease in their newborn screening. These states are New York, Missouri, Ohio, and Kentucky. The cost of adding the screening to the current test ranges from $5 to $7 for each test. This seems like a very minimal cost in the grander scheme of saving the life of a child. Many lawmakers have issues with pursuing registration for this test, considering the outcomes for the initial screen are not as accurate as one could hope for. Brenda Goodman, a writer for WebMD, states that one recent study found the test correctly identifies a child who has the early aggressive form of the disease only about 1% of the time. The other 99% of children who test positive won't have the disease, but they'll still need additional tests to rule it out. It could be argued that with this margin of error in testing, it could really create more harm than good for parents of a newborn. While this is true and could be putting unnecessary fear into the minds of parents of perfectly healthy infants, there is certainly hope that this test could save the 1% of children that are not receiving a false negative during testing. The state of Georgia has reviewed a bill that would give parents the power to choose if they would like their child screened for Krabbe disease. Giving parents the option leaves the power up to them in terms of how they would like to handle the possibility of their child having this rare condition. In Pennsylvania, parents are allowed to decide if they would like to do genetic testing before birth for other diseases. So why shouldn't they be given the same power after the birth of their child? Krabbe disease, also formerly known as globoid cell leukodystrophy, is described as a rare genetic condition that affects the central and peripheral nervous systems. An article from Children's Hospital of Pittsburgh states, in Krabbe, the body can't make an enzyme called galactosylceramidase. This leads to the loss of myelin, which protects the body's nerves and causes nerve damage. This nerve damage keeps the brain from sending signals to the body, which leads to the symptoms of Krabbe disease. Children who suffer from this disease usually develop symptoms around 6 months of age, but onset can occur in older children. The first symptoms mostly consist of fevers with an unknown cause, muscle weakness, and slow motor development or poor feeding abilities. These are usually the symptoms that lead doctors to suspect a possible genetic disease. As the disease progresses, new symptoms are developed. Some of the possible symptoms are seizures, loss of vision, loss of hearing, and new onset of nerve pain. During the development of these symptoms, most children will be offered supportive care for the management of their pain. Worsening of the current symptoms are usually towards the end of disease progression. It is very possible to help these symptoms if early testing detects the disease before symptoms begin. Once a diagnosis of Krabbe has been given, the doctor plans a course of treatment for the patient. The United Leukodystrophy Foundation, speaking on their website, says, one medical treatment that has been documented to some effect is hematopoietic stem cell transplant, also known as HSCT. This method appears to be of some benefit in cases of later onset or in an infantile patients who have been diagnosed before or at birth. HSCT is a process where stem cells from healthy bone marrow are transferred into patients with devastated or defective immune systems. A study was conducted by the Duke Pediatric Blood and Bone Marrow Transplant Program. This study was conducted in order to determine the effectiveness of HSCT in patients of different ages and severity of symptoms. The study was conducted with 16 patients, 3 of which have been diagnosed following the development of the results of their newborn screening test. According to the American Society for Transplantation and Cellular Therapy, this study is a critical period for early intervention for infantile Krabbe disease was confirmed in a cohort of patients followed over for a decade post HSCT for infantile. Improved functional outcomes were observed when HSCT was performed in the first month of life. It was reported that only one child from the study died due to progression of disease, and they did not die until 15 years after diagnosis of the disease. This is exponentially longer than the 2-year life expectancy that is given to most children with this diagnosis. Hunter Kelly was born February 14, 1997, as healthy and happy baby. Throughout his first few months of life, he was progressing normally, and then he began to slowly develop body stiffness and severe irritability. At 4 months of life, he developed body stiffness, a clear sign of Krabbe disease. When he was 5 months old, he was diagnosed with Krabbe disease, and for the next 7 years, he battled with this terrible disease. Hunter had to receive his nutrition through a tube inserted in his stomach called a G-tube, and he had to receive therapy multiple times a day. Although his family tried many methods to improve Hunter's condition, nothing was able to help him, and he tragically passed away on August 9, 2005. Hunter's grandmother, Jackie, states, "Did you know a simple hair prick through a newborn screening could have saved my grandson Hunter's life? Well, it's true. For diseases like Krabbe, early detection through the newborn screening is crucial for the affected children to receive potentially life-saving treatment." Unfortunately, cases like this appear in the United States, with the disease occurring in about 3,600 people each year. Families across the globe have to face the same truth as Hunter's family had to face. They must face the knowledge of knowing that one finger prick could have changed the entire trajectory of their lives. People may no longer have to bury their children due to this heartbreaking condition if only states will make it possible for the test to be readily available in the newborn screening process. An argument can be made by lawmakers and medical professionals that the research is limited on the effectiveness of HSCT, and this form of treatment can also be painful for the child. Limited studies are readily available, and without further research, it is truly hard to tell if their results will continue to be this positive. It is fair to say that parents had the opportunity to save their child that they would choose this route every time. It is true that there is limited research, but the research that exists is very concrete and provides very positive evidence for the early discovery and treatment of Krabbe disease. There is also very little research on how effective this testing in the United States do this test in newborn screens. Results for this information could be very essential in the convincing lawmakers that other states need to adopt this principle. To conclude, Krabbe disease could be a devastating disease that could easily turn a family's new life upside down. With the addition of this test into a newborn screen, we could see a huge change in the number of children who do not survive this condition. Krabbe disease needs to be added due to the simplicity of testing, the relatively low cost it would take, and the test's ability to save the life of many children. Although some lawmakers do not agree with this decision due to the inaccuracy of testing and the low amount of research, in order to take control of this disease, swift action needs to be taken, and this newborn screen is exactly the action that is needed. Thank you.